usefulness of protective device in carotid stenting.
First of all, carotid stenosis is a progressive narrowing. Carotid stenosis is a progressive narrowing of carotid artery due to development of atherosclerosis. Then I'll skip to save time to the types of the embolic protection devices. Different types of embolic protection devices. The first one, distal occlusion balloon, then distal filter and proximal occlusion devices. Proximal occlusion devices, device used to balloons for occlusion of the common carotid artery and the external carotid artery to achieve cessation of blood flow before angioplasty and stenting. And the other type is flow reversal system, filtered arteriovenous shunt between common carotid artery and femoral vein to produce flow reversal. Proximal occlusion devices advantage is the avoidance of plaque disruption by distal manipulation and spasm or dissection of the internal carotid artery, and the disadvantage include need of large guiding system of about 6 French to be compatible with the use of 2 balloons. This is diagram showing the flow reversal embolic protection device. Distal occlusion devices, the distal occlusion devices is inflated distally to the lesion in the ICA to prevent embolic fragments from passing distally. The distal occlusion device consists of 0.014 wire with floppy tip distal to the occlusion balloon. The occlusion balloon is inflated about from 3.6 to millimeter, and the coaxial change system allows the use of angioplasty by balloon and stent. The advantage of the distal occlusion devices, lower crossing profile and the ability to capture particles of variable size, and the disadvantage is possible embolization through the external carotid artery route or inability to perform angiography and patient intolerance due to occlusion by balloon. This diagram showing the distal occlusion protection device. Flow preservation device, actually this types of protection device which we use in clinical practice. There are 2 types of the filter, wire mounted system and bare wire system. The wire mounted system, the filter is attached to the multiple wire tip and wire body as one unit, but the bare wire system, the filter is advanced over 0.014 inch micro wire that had the passage past the lesion, and this type is suitable for tight and tortuous lesion in comparison with the wire mounted system, which isn't suitable for tight and tortuous lesions. This meta-analysis study actually gives the upper hand to the filter for protection of the ischemic stroke pre-procedure during CAS, but actually this meta-analysis was targeting the occurrence of the stroke, not the asymptomatic signal change on the brain MRI. This study also for the upper hand for the filter, as the results was 0.8% in patient treated with distal filter devices in comparison to 3.8 in non-protector. This study also showing useful of cerebral protection device significantly reduce the incidence of new diffusion lesion, but the diffusion was done 48 hours after the intervention. This is study showing that the carotid angioplasty and stent placement yield more micro imply in patients treated with filter in comparison to the unprotected. And this is study showing that there is no benefit from the filter. And this is study showing that there is 26 of patients in protected CAS group who developed signal changes in the diffusion weighted images, and 36 of patients in unprotected CAS group. This study also showing that the retrospectively analysis underwent on unprotected CAS, there was very low rate of pre-procedural stroke. Some illustrated cases, case 1, 54 years old smoker, diabetic and hypertensive patient presents with left side weakness. The angiogram showing right ICA subtotal occlusion in the proximal part, and the procedure done under the protection device filter, then angioplasty followed by deployment of the stent. And this is the filter showing small clots retained in the filter, and this is the control angiogram showing good opacification of the right cerebral hemispheres with no filling defect. And this is the pre-diffusion and post-diffusion with no incidence of there is no incidence of new ischemic lesions in the post-diffusion one. Case 2, these patients presented to us by left side hemiparesis and the Doppler showing right ICA 90% and the left one 40%. And this is the angiogram showing tight stenosis of the right ICA. Then we do this case also by the use of the filter and deployment of the stent. There is good perfusion of both cerebral hemispheres after the management of the right stenotic lesion. Also the pre and post diffusion showing no any signal changes in the post diffusion MRI. Case 3, these patients presented to us with repeated TIA, and the color Doppler showing right ICA 85% of degree of stenosis, and the diagnostic phase showing that the right ICA is tightly stenotic lesion, and there is angioplasty which is done under the protection device filter. Unfortunately, the control angiogram post angioplasty showing arrest of the flow of the ICA. We deployed the stent rapidly and then we retrieved the filter, and unfortunately the control angiography showing that there is arrest of the flow in the MCA. Mechanical thrombectomy was done rapidly in two passes and the last angiogram showing the complete recanalization of the MCA artery. And unfortunately there is a diffusion post intervention. This is a case of the same scenario, but what we did in this case is that we deployed a stent. After angioplasty also there was a rest in the flow of the ICA. Then we deployed the stent first. Then we pass through the stent by the guiding caster distally under control of aspiration and retrieved the filter slowly down through the guiding caster under aspiration, and the filter was retrieved opened. We see that the filter showing retained clots, and the control angiogram post intervention is very good, and the patient is clinically with no any neurological deficit. The first home message is that stroke considered one of the complications of CAS, so it's very important that the operator performing CAS has a high level of experience in mechanical thrombectomy. Doing CAS under protection device may be beneficial to avoid ischemic stroke during procedure. Thank you.
Thank you, Dr. Sherif, for this nice presentation.